The patient was 7 weeks pregnant in Texas and experiencing kidney failure, what many doctors would consider a life-threatening condition. But abortions there are banned after a fetal heartbeat is detected, around 6 weeks into pregnancy, unless a physician believes a medical emergency exists that prevents compliance. A full abortion ban is set to take effect in Texas in about a month, triggered by the overturning of Roe v. Wade. I was like, don't make her an appointment, Dr. Jessica Rubino, an abortion provider at Austin Women's Health Center, recounted telling her staff. I'm going to have to wait till she's actually dying. Rubino is not providing any abortions anymore, due to fears of legal culpability under Texas law. Providers can be fined at least $100,000 for each violation. Lawyers also warned Rubino that Texas has an old abortion ban that was never formally repealed after the original Roe decision. Most abortion bans that have gone into effect since Friday or will become law soon make exceptions for life-threatening situations that arise in pregnancy. But there's no clear legal definition of which conditions qualify for those exceptions, or how severe they have to be for a doctor to perform an abortion free of liability. Already, about 700 women die every year of pregnancy-related complications in the U.S., according to the Centers for Disease Control and Prevention. About 3 in 5 of those deaths are preventable. A study last year found that states that restrict abortion access have higher rates of maternal mortality than those that don't. The clearest threats to a pregnant person's life, Harris said one condition likely to qualify as a threat to a pregnant person's life is an ectopic pregnancy that ruptures pH. This occurs when the fetus develops outside the uterus, and it can cause internal bleeding and require immediate surgery. An infection in the uterus can also be immediately life-threatening, Harris said. The same is true of patients who start to hemorrhage due to issues like an ongoing miscarriage or a traumatic injury. That situation likely won't qualify as sufficiently life-threatening, Smith said. But even if there were, medical problems are highly variable. For instance, Harris said, regular high blood pressure is not something that would fall in this category of life-threatening, but for some people it might. Every person and every body is different. The threat of lawsuits may change how doctors care for patients. Most abortion bans make it a felon. Smith said she thinks many states with abortion bans have zealous prosecutors who are going to be doing whatever they can to shut down clinics and either throw doctors in jail or strip them of their licenses. So doctors may err on the side of their own legal safety when making decisions about P. Rubino said even before the Roe reversal, her Texas practice was not confident it could secure enough funding to cover the expenses or fines from a civil suit. Could multiple people sue me for the same one? If clinics stop performing emergency abortions, hospitals may still do so, but Harris said some hospitals don't have many physicians who can perform an emergency dilation and evacuation procedure, a common method of abortion after the first trimester. If in those cases physicians resort to major abdominal surgery instead, that would come at great risk to a patient and a much higher cost of complications and threat to the ability to become pregnant in the future, Harris said. Thanks for watching. Please subscribe and hit the notification bell for more breaking news.